Now, as per the classification system, we are going to talk regarding the individual fractures. In this, there is a fracture of the zygomatic arch. This is a type 2 fracture. Here we are able to see the zygomatic arch, and the zygomatic arch is fractured and moved medially. That is the medial ribbon of the fracture of the zygomatic arch has been seen. Right? In this case, this type 3 vertical displacement. When you talk of the vertical displacement, either it is outward displacement or the inward displacement. Here we are able to see that since the zygoma has been driven inside, the part of the zygoma has moved outside. This is the outward displacement of the zygomatic arch. In this, the whole of the zygoma has been displaced towards the inner side, right? In type 4 fractures of the zygoma, the rotation around the longitudinal axis, and here the zygomatic bone is toppled down in the direction of the arrow. Type 4 displacement of complex en bloc, that means that is the inferior displacement. The bone has been inferiorly displaced, all as a content bone, or it can be medially displaced on the medial side. For the sixth classification is the displacement of orbitoentral partition. Here there is a fracture of such a intensity that has caused the fracture of the partition between the orbital cavity and the sinus. So it is basically the displacement of the orbitoentral partition. Then we talk regarding the displacement of the orbital rim segments. This is the orbital ring segments that is forming the lateral wall of the orbit. Here the fracture has occurred and this part of the orbital rim has been displaced. Type 8 fracture is complex comminuted fractures. That means the bone has been shattered into a small pieces. The intensity of fracture was of such an extent.